Hello, my name is Furqan. I'm a Mededia intern, and today I'll talk about how to study for Step 2 CK. This presentation is made under the mentorship of Dr. Tariq. A little bit background about myself. I scored a 269 in Step 2 CK. I graduated in April 2021, scored a 268 in Step 1, and I had a very short and concise preparation timeline, which was around 4 months. This is my score. Now, does the score of Step 2 matter? The short answer is yes. This is the only test to objectively show your academic performance once Step 1 goes pass fail. And one thing to note is that Step 2 scores always mattered, but the recent pass fail transition of Step 1 means the weightage of Step 2 CK has increased substantially. A prediction about its significance is that it will be the deciding factor for programs to grant interviews and rank candidates for selection. Now, a little bit of comparison between Step 1 and Step 2 CK. So Step 2 is, in my opinion, a harder exam because it's harder to answer the questions. The questions are longer and more complex, and it's a longer exam. Now, there are many different reasons this exam is harder, or it seems harder for us. Some reasons are generally less time is available to prepare for this. The number of reliable resources are less. Example, for Step 1, we have first aid, Pathoma, BNB, Sketchy, and then we use Uworld. But for CK, we most often dive right into Uworld, so this could be a reason CK feels harder. Another reason that the questions in CK seem another reason CK seems hard is because questions in CK seem very vague compared to Step 1. In Step 1, we would know the answer, or we didn't know the answer. Example, the mechanism of action of quinidine. We would know the answer, or we would not know the answer. But for Step 2 CK, that is not the case. There's a lot of vagueness. For example, they would ask for the management of a patient with a breast lump, and a lot of answers in the answer choices could be potentially correct, but we have to choose the most right depending on the full vignette. And this is just something, and this isn't something that I'm just saying. I felt this all along the prep. What I mean by vagueness is that I would finish a block, um, I would finish a block and I would have no idea if I scored a 50% or a 90%. So much so that when I gave this exam, there was a small genuine concern of failing. But I also felt that I did very well. So there was a large spectrum. This was not the case in Step 1. In Step 1, before ending a block, before ending a UL block, I could be confident I scored either in the 80s or 90s, and this is a very narrow spectrum relatively. But the good thing is, for CK, UL prepares us for this uncertainty very well. For every block, you would experience this uncertainty. So by the time you do 100 blocks, you'll be used to it and you develop a sense of security and start trusting your assessment scores rather than how you feel about your performance. Because I can almost guarantee that most of us would feel very bad about our performance till the very last day. But once again, the good news is it's a harder exam, but the preparation is easier. The preparation is easier as there is less details. Example, biochem, physiology, anatomy, immunology is not there. And most of the Step 2 content, example, pathology, pharmacology, biostats have already been done in Step 1. So we only need to add on the diagnosis and management properly. Also note that this exam generally takes less time to prepare, and the reason is our strong Step 1 knowledge base. So if you ask me, how long will it take to prepare for this exam? So the first question I would ask is about your baseline. I mean, what is your knowledge base like? What's your score in Step 1? How long before did you give Step 1? So these are my these are my assessments, my scores, and the date I gave them on. And I gave CK on 14th of January. If you note, I only did NBME 7. I didn't do the rest of the NBMEs because I didn't have the time, and also the reviews about them were not very good. Example, it was said that they didn't represent the exam at all. For example, in NBME 7, the question stems on average were about 25% of the real exam. That's a lot of difference. This is my timeline. I gave step 1 in August 2020. Sorry, August 2020. And I gave my step 2 in January 2021. I started my preparation in September with online Med, then Uworld from October onwards. Initially, it was slow and then I picked up pace. I also did Anki with Uworld. These are the resources I used and I tried. So the three resources I used were Uworld, Anki, and online Med. And these are the other things that I tried. The reason Anki or Notes is in the gold category is because it helps in mastering Uworld, which technically is the only gold resource. So let's talk about Uworld. It's the number one and the only resource for Uworld most of the time, especially for CK, it's the number one and only resource. It has around 3,900 questions, which is enough to prepare us for this exam. This is our primary resource, so refer to Uworld as the ultimate resource versus going around the internet looking for the perfect information. For example, sometimes you might not find all the information in Uworld, but it's okay because uh, it's still reliable to get a very good score, far beyond our target scores. Also, like I said before, because this is the only resource, so please master this. Uh, Ways to master is make notes in your journal or OneNote and review them. Reviewing is important, obviously. Make personalized Anki cards and review them, or do more than one round. I personally did make Anki cards and reviewed them. I'll talk about that later. So one concern I frequently hear and experienced was, am I slow in UWorld? The answer is, it's okay to be slow. If you recall my timeline a few slides ago, I mentioned doing UWorld 20 questions per day and then 40 questions per day. And you can see that here. So here each dot, uh, so here you can see that here each green dot represents a 40 question block. The x-axis is the timeline. If you look before the arrow, which is around November 20, the space between each dot is greater than the space after the arrow. This is because before the arrow, it took me more than one day to do a single block. And after the arrow, I did usually finish one block in one day. But one thing to note is that do not use the absolute numbers from here. Every person's situation is different. Some can be faster than this, some slower. But for context, before the arrow was with my final year of medical school, which means attending wards and classes in the morning. And after the arrow, there was a lockdown due to COVID and I was home all day. Some more concerns about UOL one round versus greater than one round. I did one round because I was doing Anki properly, so I remembered most of UOL, and a second round would have been low yield for me. But for step two, I personally feel greater than one round is a good idea because since UOL is our main resource. So the final verdict would be to do according to your situation. If you are in your target score in the first round consistently, then give the exam or else do a second round. The other question is random versus systemic. I did random. I did random, but for step 2 CK systemic makes a lot of sense because UL is our primary resource. But let's look at the reasons for each. Random prepares you for the exam's randomness from day one, and you are less likely to get, and also you are less likely to get bored in random since you will see every system. Another reason is a stronger space repetition system with random since you're likely to simultaneously come across all the systems from day one to the last day versus systemic where you would do a system in the first week and then not touch that system again. One good thing about systemic is that you're more likely to master each system dedicatedly and systematically. Example, in random, you would see a question about Alzheimer's one day and then vascular dementia on day 6. Now, this is good for spaced repetition, but this isn't good if you're looking to understand the whole system properly. Example, to get the bigger picture. But also note, Uworld has amazing tables which compares all the similar diseases. Example, Uworld has a table which compares all the dementias together, and this table comes in all the dementia questions. So you're more likely to master this table if you do Uworld in random because you'll see this table from day one to your last day. Versus if you did systemically and just saw it while you were doing the system. But again, this would be just dementia. And if you're looking to understand the whole system, example for neuro, it would be demyelinating disorders, autoimmune diseases, movement disorders, and dementias all together to get the bigger picture, then definitely do systemic. Another route is to do a hybrid to get the best of both worlds, which is basically do half of each systematically. Example, if cardio has 500 questions, do 200 cards and then do half of the next system and so on. Basically, you're leaving half of the system for each system. Once you're done with half of each system systematically, the rest of the Q bank can be done randomly. Once again, the final verdict, I've mentioned the reasons for each, but at the end, do what makes you feel comfortable. If you're happy with random, do that and vice versa. One pro tip, this tip is especially useful if you're doing UL on random. Um, while reviewing a blog, if you come across something, example, you read in the explanation something about amputation of finger and its management, but no other information is given in that question. But you remember that you did a similar question in UL before. So what you're going to do now is you will use the search feature to look for the keyword, example amputation, then look for the question you did previously and read. Pro tip, if you are reviewing Uworld on your PC and don't want to end the block, use Uworld on your phone to search. This method helps in spaced repetition, and also this is a very active way of learning and keeps you on your toes. Now, someone here could comment and say, well, Furqan, why don't you just Google the information? Well, that's the thing. Our aim is to master Uworld, not just the information. So it's a good idea to look at the same Uworld tables and algorithm when looking for some particular information versus looking at a different table from Google for the same information. Overall, this also helps to memorize faster since you end up remembering the position of information in flowcharts of the table. The second resource we'll talk about is Online Medet. This is a collection of free videos at onlinemedet.org for Step 2 CK. This is an excellent video series to understand the bigger picture. Dr. William knows how to focus on key points to make learning efficient. He also teaches how to learn. So it's an interesting concept I came across when I came across Online Medet. These are the topics that are available on the website, basically everything for CK. What is the best way to use Online Medet? Which is to quickly go through the entire series in around less than 1 month, and you can increase the speed and also use the closed captions. Do this to get the bigger picture and then move on to Uworld, because Uworld will be our primary and only resource. Notes help. I used it, but requires premium membership. I used all the notes and I printed them out and I annotated them. But one thing to note about online method is to avoid mastering this resource, since there can be some discrepancies between this and Uworld. So leave mastering and reliability for Uworld. Uh, One reason this is helpful before doing Uworld is that online method gives an overall picture. Example, it would talk about stable, unstable angina, STEMI, and STEMI, all in a single short video, versus UWorld that only focuses on one topic. Example, stable and angina at a time in one single question. So you would not get the bigger picture. And usually this prevents us from understanding the bigger picture and the differences between, for example, let's say stable versus unstable angina's management. Also note I also purchased the online method quick tables, which are these. It includes quick tables are basically very concise tables of the diseases, which include the etiology, presentation, diagnosis, management, and follow-up. I didn't use this a lot, but it looks good to do it. One other resource that I used for online method was the whiteboards, which is basically the snapshot of each of the lecture, and there's also space for notes, so it helps to recall the lecture. Once again, I didn't use this a lot. I didn't use this at all, but it looks good. If I had the time, I might have used it. The third very important resource is Anki. Anki or the notes. Anki or notes to master UWorld. Since I used Anki, I'll talk about it, but any notes would be sufficient if reviewed properly. Anki is a flashcard application. Learn how to use it by looking at Anki tutorials on YouTube. Please use Anki or the notes to master UWorld. Mastering UWorld is the end goal. I made personalized Anki cards. You can also use pre-made decks. Uh, but the most important thing is to keep up with reviews to properly learn UWorld. I prefer personalized Anki cards. Some tips to make Anki cards. So when you make Anki cards, there is the main text that you would see. So for the main text, only put one single detail that you're more likely to focus on. The second tip is to use closed deletions, which is basically fill in the blanks. It's easier to make your cards using closed deletions, and also it's easier to review. After the main text, there's an area for extra material. Use it to paste the table, flowchart, algorithm, UL table, flowchart, or algorithm if you can. So you have the full picture in addition to the single detail you mentioned in your main text. So example, you have a card that asks urinary continence is a late feature of Alzheimer's disease. Here, Alzheimer's is a closed deletion. So you would know that this is a late feature, but this is only one single detail. So if you want the full picture in the extra, you can have a table that mentions all the early and late features of Alzheimer's. So these are some examples of the cards I made. Note the single detail in the card, and also note the closed deletion. This is basically the fill in the blanks. When I show the answer, this is what I see. Once again, look at the single detail and also look at the complete picture in the extra. I tried to blur the table, but I don't think I did a very good job. This is one more example. Once again, single detail, closed deletions, single detail, closed deletions. and some extra information. In extra, you can also have text instead of a picture. So these were my Anki settings. I could only manage around 40 new cards, but I did all the reviews for the day. So if I had around 150 reviews, I would do all of them. But I did only 40 new cards per day, and that was enough for me. I don't understand a lot of these settings, but I like the settings I use, especially note the steps in minutes, the new cards, the graduating interval, and the easy interval. You will understand these settings when you learn how to use Anki using the Anki tutorials. There's a very steep learning curve, but once you go past it, Anki is a very useful resource, not just for CK, but for any exams in the future. I'll talk about the rest of the resources. BNB CK is a very good resource I did in emergency medicine. This can potentially replace online Merit, but I haven't used it, so ask somebody who used BNB. First SCK seemed good, information correlated with Uworld, but not 100% reliable, can only be used as a supplement, not as a main resource like first aid, step 1 for step 1. MTB, forget about it. MBOSS, nah. Uworld already has around 3,900 questions, so unless you have the entire time in the world and the entire strength in the world, do it or else skip it. It's not important. Divine Podcast, people appreciate it a lot in forums, but I didn't like it. But if you're somebody who learns from these things, then go for it. Your wish. Some other pointers that I learned while I was preparing. CK questions are long. They're really long. So work on time management. Example, look for ways to do long questions fast. There are certain tips and tricks, for example, reading the last line and then the vignette, etc., etc. Look for it, see what works for you best. CK has these ad questions which are very long and time consuming, so please do them at the end. End of block to avoid wasting 5 minutes on a single question, which can potentially make you skip 5 other questions because of that. Please don't try to be brave by doing them in order. Do them last. But the good news is the blocks with the ads question in the real exam, not in Uworld, have only 38 questions instead of 40. So this gives a little extra time, but still do them last. All right. Thank you. Some final thoughts. Please trust your assessments. This is very important for CK. I've mentioned this before, but please trust your assessments since this is different from step 1 because we don't feel good about the performance till the last day. So it's a good idea to trust your assessment, especially if consistently performing around your goal score, irrespective of how you feel about your performance. That's it. Good luck. Thank you.